I've never been on the sideline for a game that matters more than the health and the safety of the athlete. Is this athlete good enough where he or she is going to play in college? Or are they going to compete in the Olympics? Or do you think they've got a chance at being a pro? If the answer is yes, then this game doesn't matter. And if the answer is no, they have no shot at being an Olympian, they have no shot at playing at college, and they're definitely not going to be a pro, then this game definitely doesn't matter. Welcome back to the Build Beyond podcast. I'm your host, Chris Netley. As always, this podcast exists to challenge and guide you so that you can reach your full potential. For this episode, I'm going to be talking about concussions. This is going to be a short episode. I'm hoping to bring on another guest in the future to go into more detail. This episode is going to be excellent for a couple different types of people. If you're a parent and you have kids who play sports, regardless of the sport, this is important for you because this is going to give you some of the basic information that you need to help make some really good and possibly very important decisions for your child. Because we know with youth sports, we don't always have medical providers on site. And sometimes when we do have people on site, they aren't up to date on the current research for concussions. This is also important for anyone who is just an active person. So you may be a young adult and you go out and you play club sports or recreational sports, or you're just an active person who likes to go hiking or climbing or riding your bike or doing anything. So a concussion can happen at any time to anyone, really with any activity. So understanding some of these basics, the most basic things about concussion, I think can be really valuable, and they can help you make good decisions early on, which good decisions early on in a concussion can have really positive effects down the line. So the information on concussions is constantly evolving and changing. I think it's about every 4 years, there's an international committee on concussion where they update They update a lot of different things, a lot of the info that we have, and then based on that information, other organizations will update their recommendations. So for example, the CDC will look at that, and then they will make some changes based on that international committee. The NFL, the NHL, a lot of sporting entities will change based on this international committee. Now, this has been, I think, somewhat disrupted because I believe there's one in 2016 in Berlin, and then it was supposed to be 2020, I think, in Paris. But with COVID, that got messed up. So we had, I think, some type of like intermittent update, but then they had something in Amsterdam in 2022, and that's where our most current guidance is based off of. So if they get back on this 4-year cycle, we should be getting some updated information in 2026. And I'm recording this now in the fall, early winter, or fall of 2025. So depending on when you listen to this, there may actually be other updates. So if you're listening to this in 2026 or beyond, what I'm telling you right now may be outdated. And that's frustrating, but it's also good news because we don't understand the brain well, but we're constantly getting more information on these subjects and on these injuries, and it's helping inform the way we handle things. Now, you may listen to this episode and you get frustrated because you say, well, that's not how my concussion was handled, or that's not how my kid's concussion was handled. Well, they may have been handled appropriately at the time based on the information that was available. So I wouldn't want you to jump to conclusions, but I'm going to go over right now what is the most current. And I'm going to actually run off of a document that was made. Is to help identify concussions in children, adolescents, and adults. And this is the Concussion Recognition Tool, the CRT6. I'll link this in the description as well. So this document is for non-medical personnel. So there are a lot of documents out there, and I'm going to kind of reference one in a minute that if you don't know, if you're not a healthcare provider and you don't have any education in concussion, it's not going to be as useful. This one is really useful. And so it starts off as saying, what is a concussion? It's a brain injury. It's technically a non-traumatic brain injury. So if you have a concussion, there is not an injury to the brain per se as far as tissue damage. If that happens, it's more than a concussion. So a concussion happens when the brain moves quickly and there's some shearing forces that go on. So it's not necessarily like a brain bruise or anything like that. It is, there's some type of mechanical force that's translated to the brain. So you don't have to get hit in the head or the neck. You could fall on your butt and get a concussion, but you've got some type of mechanical force that's translated up to the brain, and it creates some type of shearing effect of the tissues, and that results in a neurologic disruption. So the way the brain functions, so neurologically and physiologically, without technically damaging the tissue. Now, a lot of the things that cause concussions can cause tissue damage to the brain or the skull. And that, like, yeah, you have a concussion at that point, but you have something more serious. So an example would be like if you get hit hard enough and a blood vessel ruptures and you have you have a brain bleed, right? So no one's worried about the concussion symptoms. They're worried about the brain bleed, right? So these are not necessarily life-threatening, but a lot of times concussions happen in conjunction with other injuries. So you could have a fractured spine, you could have a fractured skull, you could have a brain bleed, things like that. So the early signs and symptoms of a concussion are important to notice because immediately we want to start ruling out red flags. And those are the more serious things. And that's where this document goes. So the CRT6 says a concussion is a brain injury. The Concussion Recognition Tool, the CRT6, is used by non-medically trained individuals for the identification and immediate management of suspected concussion. It is not designed to diagnose a concussion. So you're there to recognize signs and symptoms, and then if you see any red flags, to call 911 and get them on their way. The next thing on the document is just a list of red flags. And if you see any of these, you call an ambulance. So if any of the following signs are observed or complaints are reported after an impact to the head or the body, the athlete should be immediately removed from play, from the game, from any activity, and transported for urgent medical care by a healthcare professional. So what are the red flags? Neck pain and tenderness, or neck pain or tenderness, seizure, fits, convulsions, loss of vision or double vision, loss of consciousness, so they black out, increased confusion or deteriorating consciousness, so becoming less responsive or drowsy, weakness, numbness and tingling in more than one arm or leg, repeated vomiting. So sometimes people just get hit hard and they throw up, and they only throw up once. We're looking at repeated vomiting. It just keeps coming. Severe or an increasing headache. So this could be described as the worst headache they've ever had, or it starts off light, but it just keeps getting worse. Increasing restlessness, they're getting agitated or combative, or there's a visible skull deformity. You're looking at their head and there's obviously a dent or a fracture or just something going on that does not seem right with the head. Those are all red flags. Now here's something that's interesting. How often have you seen someone or been around someone or known someone who's gotten hit in a sporting event and they have neck pain or tenderness? It's pretty common, right? Now, does that mean that person has a concussion? Not necessarily, but it's a red flag. It warrants pulling them out of the game and having them evaluated. Now, I'm highlighting some of this stuff because you might be listening to this thing. Well, what am I doing? I'm endangering my kids. This is not how these injuries are handled routinely. I'm not here to point fingers at anyone. I'm just here to let you know that this is the standard. And why I bring this up is that I hear a lot of things from people and from patients and just people in general, will talk to me about concussions, and I'll listen to the way it was handled, and I just kind of, you know what I mean? Like it wasn't handled appropriately. And I think it just comes down to lack of knowledge. It's not that I don't even think it's that people are lazy. It's just that people don't realize how serious these things can be. Now, I guess I should say I'm a chiropractor, and I practice in Michigan. In the state of Michigan, I can't technically diagnose a concussion. In some states, chiropractors can. And the interesting thing is that it's with my scope of practice to be present and to recognize the signs and symptoms of a red flag and call 911. Obviously, it's also within my scope of practice to do an exam to see if someone should return to play, because I don't need to diagnose concussion to recognize the signs and symptoms of a concussion and then to move them on to a higher level of care to get them to an actual physician for a diagnosis. So my role on the sideline as a sports chiropractor is, one, to make sure that we recognize that there is a problem and that the player gets removed from play and evaluated. I need to recognize if there are any red flags and if that person needs to be moved on if it's emergent. And then I need to just, if it's not emergent, I need to go through a very specific series of steps to see if there are any signs and symptoms that could indicate a concussion, in which case it's my duty to keep them out of play and then to get them to a higher level of care. So that's how I fit into this. And for you as a parent or just a bystander, you don't have to be able to diagnose it either. You just have to recognize that there could potentially be a problem, there could potentially be a concussion, and then know what to do next. And these give you those next steps. So if you get any of those red flags, they're going to the hospital, though they should. And this might be just a handy thing to print out and just have with you. You could have it laminated. You could have it somewhere anytime when you're at a sporting event, because it might not be your kid and no one there might know what to do. So you may be the one who makes the good decision. This goes on to say that, remember, in all cases, the basic principles of first aid should be followed. So think about that. Don't attempt to move an athlete unless you're trained to do so. So if someone's down and they're out, if you don't know what you're doing, you could cause more harm than you would be helping them. So call 911. Don't remove a helmet or any other equipment unless you know what you're doing. Always assume a possible spinal cord injury in the cases of any kind of head injury. So if someone's down and they're unconscious or they're unresponsive and they're not really moving, don't go sit them up necessarily. You know what I mean? I mean, you're going to have to make a decision there, but you got to think, like, if you're not 100% sure and they've got a fractured spine, you could make it worse. Athletes with known physical and developmental disabilities should have a lower threshold for removal from play. So if someone has a developmental disability, they're already, as far as like asking them questions, maybe not going to give you the most appropriate responses or the most well thought out responses. So it gets harder to analyze. So we need to have a lower threshold. Now, if there are no red flags, identification of a possible concussion should proceed as follows. So someone goes down, they get hit. You're a parent, you go out on the field, there's no other healthcare provider around, you've got this list with you, you start going through this red flag checklist. All good. Maybe the person's already sat up on their own, so they don't have a broken neck, they're moving around, and you're not sure if this person has a concussion. So concussion should be suspected after an impact to the head or the body when the athlete seems different than usual. And this is a pretty low threshold. And ideally, if it's your kid, you're going to know. If that doesn't seem right, you got to assume that there's at least the possibility of a concussion. That person has to get removed from play. So such changes could include the presence of any one or more of the following issues. So they could have visible clues of a concussion, and we'll go over that. There's any kinds of signs and symptoms. So they could have a headache. They could have impaired brain function. So they could just be confused. Anything unusual. They need to be evaluated and pulled from play. So the kid goes down. There's no healthcare provider there. You run out on the field. You pull this list. You look at all the red flags. You clear them. None of that's going on. The player is now sitting up. They're responsive. They're talking to you. And you're trying to get an idea of, is this someone who can just get back into play, or is this someone we're going to have to pull to the side and have them evaluated? Did they lose consciousness or responsiveness? If so, we have to suspect a concussion. If they were lying motionless on the playing surface. Sometimes just kids get the wind knocked out of them or they're embarrassed. That's a hard call to make, but if it's me, they're getting pulled. If they fall unprotected to the playing surface, they don't even try and brace themselves, so they're out, or they land awkwardly on their head. Sometimes maybe someone's arms are pinned and they go down hard on their head. If they're disoriented or they're confused, so they're sitting up now and you're asking them questions and they're kind of not answering right. If they're staring or they have limited responsiveness, they're just kind of off, like gazing off into the distance, or they have an inability to respond to appropriate questions. And there's some questions actually on here that you can ask. That's what's so cool about this document. If they've got a dazed or they got a blank look, if they're having seizures or convulsions, if they're slow to get up, so you're asking them if they can get up and they're just not moving. If they're unsteady on their feet, so they have balance issues, that's a problem. And obviously if there's a facial injury, so if they're bleeding, you got to pull them. Now, you can go through and they just have checklists on here. So you could say, like, do you have a headache? Is there any pressure in your head? Are you noticing any balance issues? Is there vomiting, nausea? It just goes down this list. Literally, you can go down this checklist. Are there changes in emotions? Are there changes in thinking? Are there's, do they feel like they have brain fog? Are they slowed down? And here are some questions that you can ask. Where are we today? Do they know, like, physically where they are? What event were you doing? So you could change these questions. If maybe this is a track meet and this is a multi-sport athlete, well, what event did you just do? Who scored last in the game? If that's appropriate. What team did you play last week? Did your team win your last game? So these types of questions are great, and you can modify them as needed. Now, if anything is weird on here, if anything doesn't sit right, the athlete should be suspected that they have a concussion, and they should be immediately removed from play or practice, and they should not return to the activity, any activity with a risk of head contact with a fall or a collision, including sports, until they've been assessed medically. So this idea of like, oh, it's just a little, he got his bell rung, it's just maybe a little concussion. We don't grade concussions anymore. There are some reasons for that, but mostly because it's hard to do. Like, how do you know the difference? I think maybe at some higher levels, some physicians might still do that, but on the field, we don't. It's either concussion or no concussion immediately, because if there's any signs or symptoms, and I get it, some concussions are not as severe as others, and some are quite severe. And so there is this kind of spectrum, but for the purposes of whether or not someone's going to get removed from play and not return to play, it's a very low threshold, because we don't know. We don't know how bad this could be. And so if we're not, like, I'm in that boat, I'm not diagnosing it, I'm probably not going to be the lead on it. I just need to recognize this person needs to get pulled and they need to be evaluated. So as a parent or a bystander or a coach, you shouldn't feel awkward about this. This is important. So athletes with a suspected concussion should not be left alone initially, at least for the first 3 hours. If they have any worsening of symptoms, they should lead to immediate medical attention, especially headaches. They should not be sent home by themselves. They need to be with a responsible adult. They shouldn't drink alcohol, use drugs, unless it's prescribed by a healthcare provider. They shouldn't drive a car or any type of motor vehicle until they're cleared. Because again, we don't know if it's just a concussion or if there's something else at this point, and we don't know what the effects. Concussions have varying effects. So if someone's losing, like they're getting sleepy and drowsy because of their concussion, we definitely don't want them driving. All right, that is that document. So the Concussion Recognition Tool 6, CRT 6, I think is a must-have for parents and non-medical providers, coaches. I would have that laminated. And again, I'll link it in the description so you guys can find it. I want to look really quick at return to play. So return to play stuff is obviously beyond, if you're a parent, you are not going to be quarterbacking this return to play, but I think it's important to understand, because I just had someone recently who was telling me, I got a concussion. I think he was playing rugby. And I was like, oh, okay, well, how are you handling it? Well, I was just told to rest, and that was the end of it. So that does not fall within the return to sport protocol of how we handle it, just rest. And so I want to give you an idea. Also, if you go through an actual return to sport protocol, I think the quickest you can get through this is maybe 5 days. So if you have a concussion or suspected concussion and you're returning to competition or some type of contact within a couple days, that does not fall within the current guidelines, unfortunately. But the steps are interesting because we get people moving quickly. And I think this is something that changed. I don't know if it was I think maybe it was the 2016 guidelines. I can't remember. But it was concussion is treatable now. And part of this return to sport, return to activity has to do with aerobic activity. So for example, there are 6 steps. Step 2 is aerobic exercise. So step 6 would be a full return to sport. And step 1 is you just got that concussion. You have you're limited. Your activity is limited. So it's daily activities that do not exacerbate your symptoms. So maybe it's just walking. You may have to limit screen time, limit reading. You're going to try and get that under control. And typically what these do is these steps last for 24 hours. So if you get a full 24 hours in a step and you don't get any increase in symptoms, you can move on to the next step. And then if you move on to the next step and you have issues, you would go back to the previous step and you would repeat that. And so it would take more time. So once you have a full 24 hours of very light, limited activity, and you're feeling your symptoms aren't aggravated, then we go to a light aerobic exercise. So you start with approximately 55% of your max heart rate, and they have a way that you can estimate that on here. And then if that's okay, then you move up to 75 or 70% of your max heart rate. So they're talking about stationary bike or walking slowly. And so you're looking for, can we increase this person's heart rate to light and moderate intensity? And does that increase the symptoms? We don't know. It's extra stress. So if that's the thing, it's like, oh, my headache came back, or any of these symptoms come back or start getting worse, you got to go back, right? And then you just kind of follow this through. I'm not going to go through all these steps because, again, you as a parent or an individual, you're probably not going to be quarterbacking this. Someone's going to walk you through this or help guide you. But it's important to understand there are 6 steps. This could take about 5 to 6 days to get you through it. And complete rest, although it's great initially, is not the protocol. Like step 2 is literally aerobic exercise. It's getting people moving again. And I think there's some nuance here with medication as well. So for example, if you're taking, if you're taking anything for a headache, whether it's over counter or prescription, and it's dampening those symptoms, and you're like, oh, I'm ready to move on, that gets complicated there, because how do we know it's not the concussion has gotten better and you're getting better, or it's just you're just heavily medicated? So, if you have those questions, that's why it is important. I love having physicians involved in this, because medications, they can be valuable, and it really just depends on that individual. And that's a good conversation to have with a medical doctor. So, it's hard. It's situationally dependent, but I think it's important to know that if your kid got a concussion and you were just told to rest, and it's been a week and you don't have any follow on, that's not necessarily within the protocol, unless you've been following the protocol and they're just not moving on. So yeah, it's important information to have. This comes from, I am looking at the SCOT 6 Sport Concussion Office Assessment Tool for adults and adolescents 13 years or older. This document is, if you're not a healthcare provider and it's something to deal with, this is not a document to look at. I'm just giving you that information. So knowledge is powerful, especially when it comes to concussion. I am someone, I was born in 1982, so I'm in my mid 40s now. I got quite a few concussions as a kid playing sports, and I returned to play immediately on most of them. I don't know what the protocol was back then, if that was appropriate or not, but it just was. You get your bell rung and you get back into sports. Unfortunately, a lot of that happens now at a lot of levels. I mean, we even see it in the NFL, unfortunately. They're not supposed to. I think one of the best that I've seen so far is soccer, pro soccer. I think FIFA is starting to take this very seriously, and I'm a huge soccer fan, and they've even added for club, and I think for international, you're limited on subs, so you can only make, I think, 5 subs now in the whole game. But if someone gets a concussion, that doesn't count, because that would make an impact on a coach's decision making. So soccer takes it very seriously. NFL maybe getting better, hopefully getting better. I don't know. Other sports, I guess it's hit or miss. When money gets involved in pro sports, I don't know. It complicates things. And the interesting thing, though, so with youth sports, I'm going to give you a conversation that I've had multiple times. And this isn't just with concussion. This is with a lot of different injuries. I'll be on the sideline. Someone gets hurt. I believe we need to pull them for whatever reason, whether I know what's going on or maybe I don't, and we got to get them to a higher level of care. And it might not, let's say it's not an emergency. They don't have to go to the hospital, but they're not going back in the game. This is the conversation that I've had. I've had it with coaches, parents, and athletic directors. And it'll be like, well, they'll basically start bargaining. They want to get this athlete back in the game. And I'll be like, look, is this athlete good enough where he or she is going to play in college? Or are they going to compete in the Olympics? Or do you think they've got a chance at being a pro? If the answer is yes, then this game doesn't matter. It doesn't matter at all. If they're that good, we got to take care of this person. It doesn't matter. And if the answer is no, they have no shot at being an Olympian, they have no shot at playing at college, and they're definitely not going to be a pro, then this game definitely doesn't matter. You know what I mean? So it's a little bit of a joke, but I have had this conversation. It's like, in no scenario is risking the health and potentially the life of a youth athlete or any athlete more important than the sport itself. And I think you might see decisions like this get made in Super Bowls and things like that, where money is on the line. I don't know. That's a higher level. I'm not on the sideline for Olympic gold medalists and Super Bowls and things like that. So I've never been on the sideline for a game that matters more than the health and the safety of the athlete, regardless of what level they aspire to. So you got to think about that. If you're a parent, you want your kids to go far in sports. You don't want to mess around with concussions, multiple concussions, not good. And if you're a parent, you're thinking your kids aren't going to go that far in sports. Well, you want to, what's the point then? Why have them compete and risk it? Go get them evaluated. The worst case scenario is second impact syndrome. It's debatable on whether or not this exists. I think some countries say that it doesn't exist. It's rare. And there are some videos out there of people who have had it, and we don't quite understand it. But essentially, if you get a concussion and you've got this, there's some stuff that we know goes on in the brain. There's things get sheared. Ions, so charged particles, end up in spots where they shouldn't be. It causes some dysfunction on a cellular level. In the brain, that's not a great thing. Blood flow can be affected. Now, if your brain has not recovered from that, and you get hit again and get a second concussion, the effects can be exponentially worse. And then the worst case scenario is the possibility of a second impact syndrome, where I think the basic version of it is blood goes into the brain and it doesn't come out. And it's not like the arteries or the veins themselves are blocked in any way. It's not something that can go in and just open something up. Blood goes in and it doesn't come out. and so the brain swells. So what they do, or what I've heard that gets done, is they basically take off, it's a surgical procedure, they take off some sides of the skull to relieve the pressure, and the brain kind of sags out a little bit, it bulges, to try and preserve brain function. And then basically you pray and you hope that that on a cellular level the brain figures this out and the blood starts to go out. Now, if someone survives this, they're going to have dents in the side of their head, and they'll be mentally handicapped at best, depending on how that pressure affected the brain. It's horrible, and it's different than a brain bleed, because a brain bleed, there is actual spot that they can go in and clear that pressure and stop the bleeding. And then with second impact syndrome, it's not that simple. And so all bets are off, and it's serious. And although it doesn't happen very often, and most of us will probably never see it in our lives, thankfully, I don't know. It's just not something that you want to mess around with. And we don't know a ton about the brain, but we know a lot more than we used to. And that information is constantly being updated. So again, if you're listening to this and it's 2026 or beyond, I would look it up. You can reach out to me. I'll tell you if there's something new. We want to stay updated on this stuff. If this episode rubs you the wrong way, or you think I'm spreading misinformation, let me know. I'm literally just reading off of some documents right here. And again, I'm going to post these. I am a sports chiropractor by trade, and even though I can't, in my state, technically diagnose concussions, I try and stay as up to date as possible so that I don't miss one, and that I'm always ready to help pull people from play and give people information and get them to that higher level care, to look out for the athlete's best, to look out for their well-being, because that's what's the most important. So I hope this information is helpful. I hope you enjoyed this episode. And thanks for listening.